Hello and welcome. So the article that we're going to be talking about today is about simulating functional mitral regurgitation, FMR. So what is functional mitral regurgitation? So functional mitral regurgitation is when the valve itself is anatomically fine, but the problem lies with the structure around it. So when the structure around it is damaged, the mitral valve function gets disabled. So in this article, they're going to simulate this FMR inside a deer heart. So this is a deer heart. It's previously frozen, so it's dead. So the pulsation is going to be passive. Uh, so in order for the researchers to simulate this functional mitral regurg, the first step is to pathologize and induce this disease. And this can be done by um, induction of high pressurized fluid that is going to dilate and damage the heart and is going to lead to the heart having functional mitral regurg, and the circulation is going to be in this way, in this pathway. So after the damage has been done, they're gonna simulate the normal physiologic cardiovascular circulation, which is gonna be in this way, which is gonna by having this pump, uh, and so then they're gonna try to measure how much mitral regurg is going on. So the usual way to measure the mitral regurg amount is by using echocardiography. But in this specific scenario, echocardiography cannot be done because the fluid used in this simulation is incompatible with echocardiography. So a workaround that to solve this issue is to measure mitral regurg indirectly by measuring the cardiac output, because when the cardiac output decreases, it means that there is mitral regurg going on, assuming that the aortic valve is competent enough. And so then the article is talking about that there are two types of functional mitral regurg: ischemic or ventricular, and the second type is atrial, caused by atrial fibrillation. So the simulation that we just talked about, it simulates ventricular mitral regurg caused by, for example, ischemia in the ventricle. But if we want to simulate atrial functional mitral regurg, one way we can do that is by applying a constricting band over here, which is going to pressurize the ventricular apex, and then after we apply the pathologizing pressure, the dilation is actually going to be happening over here on the atrial side, and so it's going to be atrial functional mitral regurg. And then after the simulation, the researchers actually tried to implement some therapies to see in vitro therapies treatments for this functional mitral regurg. For example, one therapy they use is by actually stitching the two leaflets of the mitral valve in the middle, only in the middle, so it's gonna improve the mitral valve function. Thank you so much.